Well, Achilles tendinitis is generally an overuse type syndrome, but it's also fair to think of them as conditions that develop after improper training. So it's not necessarily overuse, but also sometimes improper use. Basically, it comes down to is there's a lot of stress on the Achilles tendon. It's the largest tendon in the body. It does a lot of work, and when you're running, some of the forces that can actually be taken by the Achilles tendon are about 2 to 3 times the body weight. As with other overuse syndromes of the foot and ankle, I kind of have a general approach. Number one is trying to identify what the problem is. If it's that younger athlete who's just not training properly or doesn't have the right shoe wear or whatever it is, identify what the problem is. Number two is you have to have the right shoe wear. And number three, which is stretching. We find that a really tight calf muscle is associated with Achilles tendinitis very frequently. And so just working with a patient on stretching their calf muscle, they're surprised. They come in and many times they'll even say, you know what, my calf has been a little bit tight lately, Dr. Murawski, and I say, well, that's part of it. In addition to those three things of what patients can do for themselves, if those three things don't quite nip it in the bud, then I can always send a patient to physical therapy to work on certain things. There's certain exercises that are more effective depending on the type of Achilles tendinitis. There are also other treatments such as ultrasound treatments and things like that. Biological treatment for Achilles tendinitis if it progresses to more of a degenerative condition. And then eventually there is surgeries. A lot of patients will come to surgery when it comes to Achilles tendinitis, and thankfully it's the minority of patients, but a lot of them will. And there are lots of different treatment options that are available from a surgical perspective.